Hi, I'm Dr. Barbara Roucayrol. Can you hear me? Yeah. So I'm one of the salaried GP at Blithehale Medical Center, and I was asked to come here to discuss about what we've been doing at Blithehale because our LARC number is increasing every year. So I'm going to just put the first slide pretty quickly. So that's just my own data. So it's just to show you from 2016, I did about 50 coils in 1 year. And this year, until July this morning, I've done about 25. So we've been increasing coil every year. So I know the total borough is maybe not doing so well, but in Blithehale, we've been doing a lot of coils. So I'm here to explain to you what we've been doing at Blithehale to make it happen. So how we identify patients. So we do send letters for a postnatal check to patients, and we've added a little paragraph to encourage patients to book appointments with a GP if they want to discuss their contraception, to inform them after 3 weeks after delivering the baby, they may need to start contraception. So they do have appointment date for normal 6-week check, and they are encouraged to see a GP if they want to discuss contraception sooner. During postnatal check, obviously, we also discuss about LARC. I'm one of the feeders, so I spend a lot of time explaining about coils, pros and cons, and this is how I catch most of my ladies to come back and have coils inserted. Antenatal check, I started doing more and more contraception during antenatal check. When I see patients from 36 weeks, 38 weeks, I start to tell them you should think about what's happening after you've had your baby, because you're gonna be busy with your baby, so it's good to have a plan for when the baby is born. And that's when I start sending some information. So I will show you in a minute the documents I'm using. So routine contraception appointments, mainly done by our nursing team and HTAs, receptionists. So everyone at Blithehale is really good at signposting patients to come and see me or one of my colleagues for implants or coils. So yeah, I think all the GPs are very well informed. So patients are normally added on my telephone list, and then I will assess with them. I mean, I will go in detail in a few more slides, maybe, about what I do when I call the patients. So that's how we identify patients. I also use ad hoc consultation. So myself, anyone who comes to see me with a lady, at some point they're going to have the question about their contraception. So any opportunities is good. So patients presenting with menorrhagia, dysmenorrhea can be offered LARC. Patient coming for perimenopausal symptoms, it's also an opportunity to discuss about LARC, because Mirena can also be used as part of HRT. And I really like using the 2% risk of being pregnant with condoms, because most patients are like, I'm okay, doctor, I'm using condoms, I'm fine with my contraception. And I'll just make them aware the risk of being pregnant will be 2%. And very often I've got patients a bit surprised, and they say, oh, can you tell me a bit more about more reliable contraceptive methods? So I think that works pretty well. So I think, yeah, if you can remember some figures, the 2% is a good one. So how I promote the coil. So as I said, most patients, I send them some information. At Blithehale, we're using a texting system. So I'm aware it's probably not available in all the practices, but we're able to send text messages to patients while they are in a consultation with us. And this is the two websites I'm using a lot. So the SexWise website, it's a very good one for sexual health, unplanned pregnancy, and all the types of contraception. It's very user-friendly, and it's got beautiful colors. It's a very nice one. So if you have a chance, have a look at this one, and it can be passed to patients. And the other one I'm using a lot, I think Jill will develop a bit more about this one, is the sexual, so it's the information about the IUD fitting. It's a video link, so it's a video lasting a few minutes to explain all the pros and cons of coils, and yeah, and the different types of coils as well. So it's very good for patients to watch the videos before they see me, so at least we can, they are prepared about risks and pros and cons of different types of coils. So the other ways of promoting LARC, if you in your practice, if you have these available, you can use posters, JX board as well to put messages, practice leaflet, practice website as well. You can use your patients participation group as well, just to spread a bit the information. In our practice, we do have an advocate who does some sessions sometimes with women, and she can, she did promote some LARC for us. And I don't know if it's in place, but maybe that's a way of thinking about it, having the pharmacist being involved in promoting LARC when they give the morning after pill to patients. So the barriers for LARC, from my experience, what I realized is most of the time patients don't want any hormones, and they have already painful periods, and that can be a bit of a challenge because the only thing they could have technically could be an IUD, and you don't really want to do that. We also have the patients who would be keen to have a coil, but they want to have regular periods, and I think there could be a place for Kyleena and JDES, which are like new forms of Mirena. So as you know, with Mirena you can end up having irregular bleeding, or you can have no period at all. And with these new coils, which are also smaller, so easier to insert for ladies who've never had any children, you may end up with regular bleeds. So for the past few months I've been starting using these two as well, and I do have more patients really keen to try these ones when I mentioned the regular period. So patients, some Bengali patients in our population, they're concerned about the coil moving around in the body. So I always show them a picture of the womb, I show them the coil, and I explain to them the only way you can move somewhere would be with perforation, and I explain the risk of perforation and what to do in case there is a perforation. They do their own internet research, so that's always a patients doing that, so that's why it's good to send them the link for the video counseling. And also I do push my patients who had their coil insertion at Blithehale to write up feedback on their experience. Unfortunately, it doesn't work very well, but if we have some, at least I can tell patients they can go on the website to check the experience at Blithehale. And it's also difficult for patients to take time off work because they think they need counseling appointment, maybe swab appointment, and also insertion. So when I've got them over the phone, I explain to them with a video link plus the little chat with me, that may be enough for the counseling, and then we can move straight away to the appointment for the insertion. And it's been working quite well, and we're also quite flexible around the time for patients to have their LARC sorted. So for the Coil Clinic, I've got a lovely nurse with me, or HCA, to help me to calm down the patient where they're a bit stressed and scared. I do give sleep before the coil fitting, so patients know what to expect, because as we do give a lot of information, you want to make sure they don't forget the silly things. So I tell them, make sure you have your breakfast, because we do have the ladies coming without any breakfast and they may faint. So to bring a pad, having their breakfast, so they do have a little sleep with them when I speak to them or when I saw them before the appointment. So patients are booked in the Coil Clinic after the telephone slots. We don't really have a DNA in our clinic because I do the booking myself, and I explain to them if they DNA, they may not be rebooked for another few weeks or few months. And I think it's a trust relationship. It works really well at Blithehale. So at the beginning of the clinic, we had the receptionist calling all the patients first thing in the morning to make sure they were attending. We don't need to do that anymore. So yeah, and the Coil Clinic we have a set day for that, but we can be quite flexible. So for the post-fitting, I give them just a small leaflet with what to expect in terms of contraception, what to do, symptoms for infection. We advise on a self-check at 6 weeks, so we do not need to see the patient again unless there's a problem. And I work every morning, so I always offer the patient to call me if there's any problem in the next few weeks after the insertion. And as I mentioned earlier, I also tell them, if you have 5 minutes, please write up your experience on it. It's just a choice, because that could help for all the patients later. So we've been starting doing some inter-practice referral, and it's been working really well last year. We did have about 10 or 15 patients with implants and coils. So the way it worked, we really open about how you can refer patients. So I do have a receptionist at Spitalfield who email me directly, name of the patient and telephone number, and I call back patient. I'll be on hand to send referral by email or fax. I'm not too sure, but I do have papers in my tray sometimes. All the patients are always called back lunchtime within the next 5 days. So I think we're going to send an email around to the practices from our network, so when patients are aware they're going to be referred to Blithehale, they need to expect a phone call within 5 days between 12 and 1. The way we could improve the practice, the inter-practice referral is firstly make sure we do have a telephone number, because we did have a few occasions where we had to chase up numbers for patients to call them back. And also I'm trying to find a way of how we could make sure the clinician or the receptionist give the detail of our surgery to the patient, because patients have no idea where they're going to have their coil fitted and they don't have our telephone number, and that's good for them to be able to cancel when they are booked. And also, if they could be sending the link before patients are talking to me over the phone, that could just save a bit of time when I speak to them, because ideally they would have watched the video before talking to me if they have any questions. So it's been working quite well. I think we can do better with the inter-practice referral. So yes, so the useful contacts to refer patient to us, you're always welcome to email me directly. I think you can also ask patients to contact Blithehale directly, because they can call us, and receptionists are aware of this inter-practice referral, so they can add the patient on my telephone list and I can call them back when it's more convenient for them. And or referral can be emailed to Blithehale Medical Center. So that's for a network too, I suppose. Voilà.
Thank you.